Dr. Lalit Maini sir, thank you so much for your time. Dr. Lalit Maini sir is actually the orthopedic professor from Maulana Medical College, and he's been responsible for educating the set students in the area of orthopedic specialization. And Doctor is also a key respondent on technology. He's been absorbing technology, learning technology, and sharing the insights on technology. And 3D printing has been his passion. And also, now that he's also gaining his insight on virtual reality going forward in terms of how it can actually help the orthopedic application. Doctor, thank you so much for your time. And
thank you, Busha.
Let me congratulate you, Doctor, for being awarded the 3D Graphy Medical Awardee for orthopedic surgeon in promoting education and research in your space of interest.
Thanks a lot. Thanks. Honored to have that.
It's our privilege, sir, to actually honor you with this particular award. And we know that we will definitely benefit with your insights going forward for the orthopedic respondents in the near future. Doctor, let me ask you in brief, how did it all start? How did you get tilted towards 3D printing as an orthopedic surgeon? I would want to know your journey in this space.
That's a pretty deep question. It started surprisingly quite a few years back, maybe around 15, 17 years back. I do travel a lot on education and collaborative targets. So being in Australia in a trauma center a few years back, I think it was around 15 years back, when I was there for a complex hip sort of observation and exchange program, we came across a neurosurgeon who was 3D printing using wax. So he would use wax as the material, and he would 3D print models for the orthopedic surgeons for complex hip fractures and give it to them. And then he would melt that wax and again use it again. This was a long time back, and this was almost like magic to me, and it stuck in my mind. And when I came back, I exchanged this knowledge with many of my colleagues, my engineering friends, but I didn't get an answer that this can be done. And it looked like it is some technology which is there in that continent, and maybe it will come one day. But then around a decade back, when I started doing research projects and postgraduate students would join me, it came back to me, let's explore again. So I sent my postgraduate student to various engineering institutes asking if 3D printing could be given as a solution. It had to click. And this was IIT 3D in 13 or 12, I think. And that is where we started printing our first 3D printed models for hip fractures. And we used to print real-time models, and it used to take around 24 hours to build the model, and then there was some setting up time. So we used to wait for 2 days before we used to get the model. And the first project started in which we did 10 real-time models in complex hip fractures and use them to benefit the outcome in those fractures. So that's where the journey started. And then we got an option of interacting with the engineering friends, and we've done so much after that we've published a lot. We've used 3D printing in a lot of different applications in orthopedics.
Okay, with the recent conference, the 3D Graphy Medical Conference that we organized, where you are a key respondent, doctor, for orthopedic application, you did mention about HA coatings. What was your challenge area and expertise that probably the solution you were looking at? If you can just broadly brief it and then.
So, in the journey of 3D printing, it started with models, and then it went on to doing your surgeries preoperatively on those models. It went on to developing customized solutions. So the peak is where we develop a customized solution for a patient, and then came in the materials into it. So we were working basically on medical grade titanium, that being the most biocompatible and most isoelastic to bone. But then we had this thought in our process that any metal which we are going to use is not going to integrate with time. There would be its own life, and unless it is a solution, it is a material which gets integrated with the body itself. Actually, it's a race between failure and the solution. So that is where we came up with this thought that if we have a biointegrative material, hydroxyapatite being the most popular in for bone, then the bone and the tissues, the muscle around could integrate. And if we could create something which integrates with time and also has the strength and the patient specific sort of a solution to start with, then it becomes a solution which would actually probably become a permanent solution. And once it integrates, it is actually a part of the body, and we don't have to worry anymore. So to make the 3D printed solutions a complete solution, if I could say, probably hydroxyapatite coating as well as hydroxyapatite as a substrate to do the 3D printing itself for the scaffold and the designing could be one of the ways forward. So trying to make it a biological solution, starting as a biological solution on a patient-specific solution to the problem.
Interesting, Doctor. Doctor, what do you think about the current educational, system where technologies like 3D printing obviously is a tool, but the larger interest would be to also see that how medical students can also benefit the course, because as professionals, when they come to the space, for them to absorb technologies would be very good eventually for them to make things more easier and conveniently done with efficiency. But can it be also imparted as a curriculum in medical colleges, Doctor, with these technology? Because that's the need of the hour, is what we believe. We've been a catalyst in terms of promoting the technology. What do you think about that, Doctor? Is there an amalgamation in terms of also having a course structure in that area? Would you feel?
Yes, I think it has a key role in education, not only of the surgeon. I think it has a key role of educating the patient, the masses. It has a key role in educating the residents who are into training rotations. It has a key role into even the faculty who is already into providing healthcare and who have to diversify into more complex sort of scenarios. So these are perfect sort of starting points, especially is now giving a possibility of a real field sort of a scenario. So the student education, there were complex problems which were taught to our students. Classically, the point to create a 3D printed model, and it's a beautiful starting point to show the patient, to show the student in real time on what patient. So it opens up a real huge new avenue which never existed before. that we can sort of give you the real time feel of the three-dimensional structure of the particular problem, as well as a feel because of the materials giving the possibility of almost the real time feel of and the other advantage of this technology is that it can be transferred through the internet. So if you have a complex sort of a condition, it can be shared with a person across the globe, and they can print it there, and you can then discuss the whole issue with a team which just at the starting point of using it.
Good, doctor. So, doctor, do you think, doctor, a platform like these, the 3D Graphy Medical Expo, and also workshops that we plan to do on an ongoing basis for various subjects on orthopedics and materials and dental would be a great idea? How do you think about a platform like these, doctor? What is your feeling about this particular platform?
Is an amazing platform in which it has exposed us to all the possibilities which we were actually searching for. We want to sort of get to know the like-minded people who are working in the similar field of specialization and trying to produce solutions. So like we got to listen to people from South America about the role of copper in preventing infection and regulating infection, printing and giving solutions, and also the possibility of bioprinting. I have actually registered for the bioprinting course, which I got to know through this platform, and I'm going to start that coming week. So I think 3D Graphy is a boon to people who have entered this field of 3D printing.
Thank you so much, doctor. And it's always a pleasure to connect with you, doctor, and also to get insights coming from you. And I'm sure going forward, we will work together with a larger interest to see how the information can be disseminated rightly to the last end of the respondent who can benefit from this particular association. And congratulations once again, doctor, for you being honored with this award. And it's always a pleasure to connect with you. Thank you so much, and thanks for your time, doctor.
Dr. Shivu, I think I missed your.
Yes,
Can you come again?
yeah. So I'm saying thank you so much, doctor, for your wonderful insights, and it was always a pleasure talking to you. And once again, wishing you all the best, and also congratulating you for this 3D Graphy.
Thank you. Yeah.
And look forward to you always, being in touch with you, doctor, to see how this technology can be well disseminated through our platforms. And we would love to work with you, doctor, going forward as we progress.
Thank you so much. Thank you, Shivu.
Thank you, doctor. Thank you.